I think what's really important about the Rio conference is that we make stronger links between health and sustainable development. At the moment, these two debates are almost going on completely disconnected and separately, but in fact they're inextricably linked. Many of the factors that are driving the non-communicable disease epidemic are also factors that are linked to unsustainable lifestyles. So, for example, sedentarism is a very important risk factor for a whole range of chronic diseases. And that's partly related to the kind of transport policies that we have, the fact that we use private cars much more intensely than we used to, that people have very sedentary lifestyles in which there's very little physical activity. So getting people out of their cars in urban centres, undertaking more active travel, walking and cycling, could reduce greenhouse gas emissions but also improve public health. Electricity generation. In many parts of the world, people burn coal for electricity, and that contributes a lot to outdoor air pollution. So the fine particles produced contribute to outdoor air pollution, which is responsible for about 1.3 million deaths a year, a combination of coal and also car vehicle exhaust emissions. So again, these are linked to climate change because the same factors are driving greenhouse gas emissions as well. And food and agriculture is also unsustainable. There's an increasing demand for animal products, which is going to result in increased greenhouse gas emissions, increased deforestation, but also, of course, consumption of animal-sourced saturated fats is also an important risk factor for ischemic heart disease, for example. So in these ways, health and sustainability are inextricably linked together, and we need to put into place more policies that address some of the causes of unsustainability and at the same time improve public health. Several things I think need to be done. One is I think we need more to change national tax systems to reflect the kind of external damages that our lifestyles wreak on the environment and indeed in public health. So for example, things like carbon taxes, maybe even fat taxes. Now there are concerns about these. There are concerns they might increase inequities, so we need to research them and study them. But in the long run, I think until we start taxing some of the things that are driving unsustainability and driving some of the public health problems that are confronting us, we're probably not going to deal very effectively with their root causes.